Hi, I'm Abby Claire McAfee, and this is my Week 9 presentation for Pathophysiology. This week we had to do a syndrome, and so I chose Down syndrome. Down syndrome is just called the trisomy 21, and it's an extra pair of the 21st chromosome. So kids with Down syndrome have 47 chromosomes, while normal people have 46. This is due to the abnormal cell division during gestational periods. Some general clinical manifestations of this disease include physical as well as intellectual and developmental differences. Physical, you can tell by their facial features. They normally have a flattened face and a flattened nose, as well as a shorter neck, shorter hands with shorter fingers, and they have poor muscle tone. So what this means normally is that it takes a kid with Down syndrome longer to, for instance, roll over. A normal child might roll over at 4 months old, and a kid with Down syndrome might roll over at a year old. Then also there are intellectual. They have very short attention spans, and this is normally seen later on in life. Once they get into school, get into rhythms, they'll learn this. They have poor judgment, slow learning, delayed language and speech, and impulsive behavior. This impulsive behavior helps them in ways that they feel secure because they did something that way. So we were also asked to identify some other syndromes that are like this. And so since Down syndrome is genetics, I chose Edwards syndrome, which is trisomy 18. And this is caused by the extra chromosome 18. And just like Down syndrome, except opposite with 21 versus 18. This one's 18. This is normally a low birth weight. They have problems with their heart, their kidney, their liver, but most of the kids die within a year of this age. Trisomy 16 is mostly common in what's found in miscarriages in most women. This is basically incompatible with life. They are normally aborted or they pass away before the second trimester. And then the third chromosome syndrome I decided to do is something that's a little bit different. Those are both trisominies, but I decided to do the XYY syndrome, and it is where they have an extra Y chromosome. There's normally not any medical and physical changes to anybody that has this. It's most common in men, and normally whenever somebody has this, they are taller and they might have a decrease in learning ability, but it's not as much different. So some normal diseases with Down syndrome, the first one I chose was a cardiovascular disease, and it's atrioventricular septic defect, and it's called AVSD, and it's where there's holes in the heart. You were born with this. It does not, you don't find this later on in life. This is what you're born with, and the treatment of this is normally just surgery. But this affects the blood flow, so it does have to be treated. Then there's also hypothyroidism, where the thyroid gland produces not enough or or none of the thyroid hormone, which controls all of your bodily functions, such as your body temperature, your eat-sleep cycles, your energy. So most kids will have this and they just feel tired all the time, and this is one of the reasons why they have it, is the hypothyroidism. You can be born with it, but also they can develop it later on in life. So normally they run tests with it, and it can be treated by just taking a little bit of the thyroid hormone through the mouth. Then there is duodenal atresia, and it is a deformity in the small tube that connects the stomach to the small bladder. So normally the tube is supposed to be bigger, but with these kids it's small and it's almost completely shut off. So this causes them to vomit once they're full because it doesn't have anywhere to go. It's stuck in the stomach. They have reduction of BMs and urination. It's hard for them to get that waste out of their system because it's stuck in their stomach. And normally their upper abdomen when born will be swollen. There's surgery to fix this, and they are always born with this. So thank you and have a great day.